We'll be joined on today's COVID-19 briefing by experts who will talk about prioritizing mental health during the pandemic. Let's listen in.
And thank you for joining the press call this afternoon. On the phone with Governor Walz and Lieutenant Governor Flanagan today are mental health care professionals and advocates from across the state. We're joined by Julie Hannenberg, the Executive Director of Lighthouse Child and Family Services, Jody Nelson, the Executive Director of Change, Inc., Sue Abner-Holden, the Executive Director of NAMI, Minnesota, as well as Commissioner Jody Harpstead of the Department of Human Services. Just a reminder to all the reporters participating in the call today, we ask that each reporter limit themselves to one question with an on-topic follow-up, just to ensure that we can get to as many questions from as many different media outlets as possible. And with that, I will turn it over to Minnesota Governor Tim Walz.
Thank you, Teddy, and good afternoon, Minnesotans. It's good to be back with you again. I am not telling you anything you don't know. It's been a really hard week here in Minnesota, from record numbers of COVID cases to the deaths. And again, 68 of our neighbors being reported today having lost their lives, and of course, families that are in grief. We made moves earlier this week and that will go into effect tonight to mitigate the spread of the virus, to preserve our hospital capacity, to protect our healthcare workers, and to try and make a difference. But as I've said all along, it comes at a horrible cost. There's an economic cost that comes with these decisions. There's also mental health cost that comes for all of us. And I think it needs to be acknowledged that feeling a sense of anxiety or feeling a sense of frustration or desperation is not all that unusual in these times. And that's a perfectly normal place to be. I'd like to thank all the folks who were involved with last night's lighting up of Minnesota. If some of you didn't get a chance, I'd encourage you to go online and search this, that our landmarks and buildings and communities, large and small, were lit up, from the Split Rock Lighthouse and the Lift Bridge up in Duluth to the Otter in Fergus Falls and every place in between. And seeing folks do that in acknowledgement of the lives that we've lost, but in acknowledgement and a thank you to healthcare workers. I was texting my staff last night as I was watching those pictures come in, and it did lift the spirits. It did show that we're in this together and we're not alone. It may feel that way at times, but we're not. I also want to talk, and again, you're going to hear from our state's leaders in this, who I have gotten to know. There's folks on here like Sue, whose work around mental health I have worked with going back to my time in Congress. And then I'd like to take a special note. You hear a lot from Commissioner Malcolm, doing incredible work, here to answer any questions, as she always is, 24 hours a day. Steve Grove, the same way, working with our businesses. But there's 22 other commissioners that are doing incredible work day in and day out. And one of our largest agencies and one of the most trying jobs in all this is Commissioner Jody Harpstead at Human Services, providing for our most vulnerable and doing so with just incredible results. So I want to thank them, and then acknowledge that all the help in the private sector. And today I'm announcing that IKEA US Community Foundation is donating $1.2 million to the state of Minnesota to show their appreciation for the state's support of workers who've been unemployed, but also to know that we're going to use that funding to support mental health services for Minnesota students. Those funds are going to provide resources to the SchoolLink mental health program, which includes 58 mental health providers covering 1,100 school sites across the state. These providers play a critical role in caring for the health of our children and families, especially now, coping with the isolation and the stress that come on with distant learning. And earlier this year, and thanking the legislature and the federal government, we used $3 million of our CARES Act dollars to support mental health care needs for children, youth, and families. So more than ever, prioritizing you, your families, your neighbors' health, top priority. The mental health toll that this is taking as we move into winter is real. Don't wait if you need help. There's plenty of it out there. And now it's just a text away. Minnesota has a 24-hour, 7 days a week emergency line, crisis text line. If you just text MN to 741-741, Minnesota 741-741, you'll talk to folks out there. And as I said, it is a very common space that all of us are in, and the stress that we're feeling. And so with that, I'd like to turn it over to my friend and someone who helps carry the burden of a lot of the things that are happening here, Lieutenant Governor Peggy Flanagan.
Thanks so much, Governor. Good afternoon, everyone. Well, we know that the COVID-19 pandemic has had a significant impact on the mental health and emotional well-being of Minnesotans across the state. So many of us are experiencing increased levels of stress and fear and worry, loneliness, or anxiety during these challenging times. And if these words resonate with you, I want you to know that you are not alone. It's so important that we prioritize our mental health and well-being now more than ever. And although I'm Lieutenant Governor, I still can tell you that I personally need to find that time to refocus and to de-stress. I like to take a walk at the local nature center by my house, and do art projects with my daughter, call my mom, or watch really bad reality TV. But, for some of us, those activities aren't enough, and you need extra help. Please don't wait. There is no shame in asking for help, especially after we've been in this for so many months and it's getting harder in this moment. So help is just a text away. Minnesota has a crisis text line, and this 24/7 emergency service is available if you or someone you know is experiencing a psychiatric or mental health crisis. So all you need to do is text MN to 741-741. And there's so many other resources that are available to you as well. You can visit mn.gov/COVID-19/get-help to find resources for childcare assistance, housing support, food instability, unemployment resources, or other stressors that may be impacting your well-being right now. Now more than ever, we have to take care of ourselves and take care of each other. We're in this together, so please, please reach out if you need help. Getting the help that you need, again, is not shameful. It's not embarrassing. It's human, and it is necessary. We have never experienced anything like this in our lifetime, and being able to lean on one another and ask for additional support is how we will be able to sustain ourselves and get to the other side of this pandemic. So with that, I'm really honored to turn it over to Julie Hannenberg, who's the Executive Director of Lighthouse Child and Family Services in Malacca, Minnesota. Julie?
Good afternoon, and thank you. I wanted to share that our main office is located in Malacca, with other offices in Princeton, Cambridge, and St. Cloud, and we provide at Lighthouse services across 7 counties, most of which are predominantly rural. We offer an array of services, including schooling to mental health therapy, outpatient therapy, adult rehabilitative services, day treatment services, as well as several other services. We at Lighthouse are very grateful for the support from the IKEA donations and want to thank all who made those funds possible. Our mental health and well-being is so very important to pay attention to in these pandemic times. COVID fatigue is real. We are all impacted by COVID. It's not a question, it's a fact. Whether you're an adult who's been impacted by a change in employment, ranging from a loss of a job to added hours to cover for coworkers, your experience is valid. Those experiences may be impacting your mental health. Now, let's add social distancing to the families with school-aged kids. You are balancing so many aspects of life. Children are overwhelmed without a doubt. They are missing sports, their friends, teachers, and routine. So let's think about that together. If you're an adult and you're anxious about what's happening around you, let's think about the impact that has on a 10-year-old developing brain, a 6-year-old developing brain. We also know that children ages birth to 3 are at their most crucial stage of brain development. Environmental stress impacts them as well. This is hard on all of us. One concern I have is that we know people are experiencing higher than normal levels of stress, yet we haven't seen an increase in our community members seeking help. Sometimes when we're overwhelmed, it feels like more work to schedule an appointment, but now, more than ever, it's imperative that we pay attention to ourselves and one another, that we encourage and help our loved ones seek help if they need it. On a positive note, it's never been easier to access mental health services. Telehealth has changed the landscape of the mental health system. Initially, in March, most of the families we were working with declined telehealth services. They wanted to wait until in-person services were available again. In the last several weeks, we've noticed people are more accepting of telehealth, which is amazing. Our staff have worked hard to be creative in their sessions using technology to keep children, adolescents, and adults engaged. It's quite amazing how well our staff have adapted to ensure their clients have the best experience possible. For some of our most rural families, telehealth is not an option due to poor internet or simply no access to internet services at all. Given this, we will continue to offer in-person services for our community members. It's important to know that there are many types and levels of mental health services. You just need to reach out to ask what your options are and what would be most appropriate for you. Mental health providers can provide a safe space to talk about and process what you're experiencing. There is no shame in that. Truly, you do not have to go through this alone. Please remember, no matter who you are, no matter where you live, there are mental health providers in your community that are ready to support you in your emotional and mental well-being. I thank you for this opportunity to share. And next we'll hear from Jody Nelson.
Hi, good afternoon. Thanks, Julie. I'm Jody Nelson. I'm the Executive Director of Change, Inc., and I'm glad to be with you this afternoon to share some of my experiences and thoughts related to the importance of attending to our mental and emotional well-being during the pandemic and this epic time of uncertainty. Change, Inc. provides outpatient and school-based mental health and support services in Minneapolis and St. Paul, and is the lead agency for a DHS-funded school-linked mental health grant in Ramsey County, which involves 5 other providers and support from both the suburban and St. Paul district, as well as the collaborative and the county. When schools went into distance learning mode in March, we, like most other providers of mental health services, made the move to telehealth. At the same time, we were, and still are, committed to finding innovative ways to meet the needs of children, youth, and families. So we've also implemented such efforts as walk and talk, which are socially distanced, masked up sessions in the out of doors. Minnesota has been the national leader in the development of school-linked mental health services, and we are grateful for the support from the legislature, DHS, and now IKEA to bring additional support to this effort so that we can weather this disruption. A major challenge has been the ability to assess for mental health needs when children or youth are not in school. And added to this is the exhaustion parents are experiencing, as well as screen fatigue for everybody. This additional funding allows us to continue to be innovative in how we outreach and support schools and families at this time. A trend that we are seeing is the stress carried by adults who care about kids, parents, other caregivers, teachers, and school staff. A lot of adults are reporting that they feel like they are failing at parenting, at working, at teaching. But we can help. As therapists, we know the difference that simply being seen and heard can make to someone's well-being. We also know how important it is for everyone to feel affirmed and validated. And we have tools and strategies to help if someone's mood is spun up due to all the epic crises we are facing, or conversely, if someone's mood is checked out. Mental health is like the 3 bears story: too little, too much, just right. And we can help you to get it just right. You've probably heard about PTSD, post-traumatic stress disorder, but you may not have heard about post-traumatic growth, but it's a thing. And we can emerge from the pandemic and other stressors with learning and new skills we didn't have before. It will take being in relationship with others, even a therapist, to get to that place of growth. Reach out. A helping hand is ready to grab yours. And with that, it's my pleasure to hand the baton here to Sue Haberholden.
Thank you. You know, we all are struggling with our mental health. We're really having a normal response to an abnormal world, a world filled with great uncertainty, isolation, limited physical activity, financial insecurity, and great stress. A new study released this month found that almost half of young adults are showing at least moderate symptoms of depression, and more than a third had thoughts of suicide or death. Mental health-related emergency room visits are higher than last year. You know, many children have actually lost access to the health and mental health care that was provided through their schools, along with food and other social services. And teachers don't have the same eyes on their kids, their students, to detect signs of poor mental health. So we as adults all need to be aware of those signs and symptoms. Things like excessive fears or worries, significant tiredness, changes in sleeping or eating habits, even things like inability to cope with daily problems. We are especially concerned about special ed students who don't have those additional supports at home and whose parents are struggling to help them with distance learning. And we know that children from BIPOC communities are at greater risk during this time. As a community, we need to be mindful and deliberate in terms of what we do to help our children and youth. That means as adults, we need to reassure them that they are safe, and we need to help them develop coping strategies such as breathing and mindfulness by modeling them. And we need to help them stay connected to others. It also means that we need to increase awareness about mental health services that are available during the pandemic. School-linked mental health programs are in many schools across the state, and parents need to know that they exist and how to contact them. And every school, hospital, and clinic should have the crisis text line on their websites. And parents, you need to write this down and post it in your home on your refrigerator. And again, that's text MN for Minnesota to 741-741. We also need to make sure that our fragile mental health system has the resources to meet these increasing needs. While we worry about protecting the health of our children during the pandemic, let's remember that their mental health is equally as important. There are many organizations out there, such as NAMI, Minnesota Association for Children's Mental Health, and Mental Health Minnesota, that have resources that can help parents and adults navigate both the children and adult mental health system. We need to mind our mental health during this most difficult time. And at this time, I'd like to turn it over to Commissioner Harpstead, Commissioner of the Department of Human Services.
Thank you, Sue. Well, the outbreak of COVID-19 has been stressful for everyone on the planet, more than we may even realize. Every day we're worried about our families, our communities, and our health. It can be overwhelming, cause fear and anxiety. It can make us feel isolated from family, friends, and coworkers, especially during these odd holidays. And children are of special concern. The school-linked mental health program breaks down barriers to accessing mental health services by connecting to kids through their schools, whether they're in class full-time, part-time, or learning remotely. This generous donation from IKEA will help us improve safety measures so students can continue to receive services face-to-face when they need them. Or when in-person services aren't an option, to make sure they stay connected to school-linked mental health services through telemedicine. Schools and mental health professionals deserve special recognition for the work they have done to make this possible for more than 18,000 students and their families within 1,100 schools across the state. Telemedicine for school-linked mental health is just one of the more than 100 changes by the Minnesota Department of Human Services over the past 8 months to make sure people can continue to get the services they need while staying safe from COVID-19. We've taken steps to preserve coverage for more than 1 million Minnesotans who receive their health coverage, including coverage for mental health services through medical assistance and Minnesota Care. We've expanded access to telemedicine and temporarily eased certain limits for receiving services through telephone and video visits. We're also allowing organizations that receive mental health grants flexibility to support social distancing. That could mean finding alternatives to providing services face-to-face, or using funding to buy safety equipment. What's important for Minnesotans to know right now is that help is available. As others have said, if you just need to talk or text with someone, free confidential support from a mental health professional is available through Warm Lines. If you or someone you know is in crisis, you can talk for free to professionals who can help by contacting crisis response services in your area or through the National Suicide Prevention Lifeline. More information about how to connect with help when you need it can be found, as the Lieutenant Governor said, by visiting mn.gov/COVID-19/4Minnesotans/get-help. I want to add my personal thanks to IKEA for deciding to pay it forward to school kids needing support during this time. Back to you, Governor Walz.
Well, thank you, Commissioner. And to Minnesotans, every day I'm honored at the incredible privilege of serving as your governor. But knowing that this state is full of incredible leaders, true servant leaders, like you just heard from, experts that exhibit wisdom, experience, compassion, it makes me hopeful. And I think during the time of COVID-19, being hopeful is a good thing. And so with that, I would open it up for any questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Again, if you would like to ask a question, press star, then the number 1 on your telephone keypad. Your first question comes from the line of Dave Ardick from Pioneer Press. Your line is open.
Hi, Dave.
I'm sorry. I was on mute. I apologize about that, everyone. I had a question regarding not exactly on this topic. Governor, there has been a lot of people in the fitness industry complaining about the restrictions on the fitness centers. And what can you tell them about the decision to close them down and not other places? Thank you.
Yeah, and I just want to be very clear, and this is one, and so many things about COVID-19 are so counterintuitive or yet very frustrating. We certainly want people we know that there's a strong connection between physical health and mental health, and the ability at a time when it feels like you have no control over anything. I know for me, getting the run in matters. I think it comes down to this, Dave, is what we tried to talk about, whether it's numbers or more importantly, what we've learned about COVID-19, the idea that you're inside, you're breathing hard. And I want to note that these fitness centers, whether they be small or whether they be large national chains, have done incredible work to try and minimize the spread of some of the air filtration systems. But what we know is we've seen this across the country, and I think the data supports this. Being inside, which you are with a fitness facility for an extended period of time, exerting and breathing harder, what we know about the aerosols of this, that we think the community spread. Now, one of the things is all ages, of course, attend fitness centers, but some of the highest numbers are right in that category of 18 to 35-year-olds. So what you're seeing is asymptomatic spread. And I remind Minnesotans of this. That's someone who, through no fault of their own, certainly isn't intentionally trying to do so, may be infected and not know it, and in that environment. So Jan, I don't know if you want to add anything, if you want to add any data. I always think that, we get into talking about primary cases and then the 70 cases that spread from that, and why did you choose this when we know that there's a lot of unknown community spread. I think it's just using what we've learned about COVID to extrapolate that those are areas where spread is happening.
Yeah, Governor, this is Commissioner Malcolm. I really don't have too much to add. As you said, it's, folks do look at the data. They ask us, well, how many cases and how many outbreaks? And as the governor said, we do have numbers that do quantify some level of risk, but it's really the inherent risk in the environment that truly is a national phenomenon.
Thank you.
Okay, next question comes from the line of Brian Baxt from Minnesota Public Radio. Your line is open.
Hi, Governor. I'm also going to stray a bit, even though you're acknowledging that sometimes these financial issues and issues of whether you have a job can have an effect on mental health. You're under a lot of pressure from groups of the service industry, the owners and the workers to come forward with some sort of immediate relief, not necessarily waiting on Washington. How far are you willing to go, and are you looking at the potential of tapping into the reserves to get some money out the door in consultation with the legislature?
Yes, yes is the answer to that. And again, I think for Minnesotans to think about this, we know that there's huge repercussions of the decisions we make. And again, the hospitality industry, because the nature of close contact, indoor, extended period of times, unmasked, we continue to talk about that. But the fact of the matter is, when these people are following these orders and closing their doors, they're protecting the entire community. They're protecting the workforce. And what we did early in the pandemic was acknowledge that by that we're all going to share it. By our tax dollars, we pool them together and help these folks out who are helping all of us. Because of the inability to move at DC, and I want to note, I spoke last night extensively with Senator Klobuchar, who just yesterday spoke to 15 Republican senators, worked an 18-hour day to bring folks back to the table. But Brian's question is the one that I think we can't wait. We can't wait on Washington. We certainly can't just say, well, ready and get it done, and that's too bad. So I'm doing all we can. I'm asking Commissioner Showalter at Minnesota Management and Budget, Commissioner Doty over at Revenue, all of them to put the best minds together to see what we can do. And I think the answer is we need to do something. It won't be enough, but we need to do something in the very short run here to provide a bit of a lifeline to get these folks through. So they're exactly right in asking. I do think everyone needs to acknowledge this, that the closing of these businesses is in the public good, that all of us share a responsibility to try and help out.
And Governor, you met this morning with some legislative leaders, presumably by phone or other means. Is there any place where you guys have come to at least tentative agreements for things that would come up in this December special session?
Not at this time, but and I want to acknowledge that idea of working together. And I will tell you, I will continue to do all I can. I felt a real sense of collaboration. Legislators spent an hour on a briefing with us to try and find common ground. They asked incredibly good questions across the political spectrum, but focusing on these issues. We haven't got detailed on this, but I think, I'm hearing all of, in the public like I'm doing right now, that yes, we need to find something here in the state of Minnesota like we do. I mean, it was brilliant. The legislators did this when we created our own emergency relief fund, where we might not qualify for FEMA funding in a flood or an ice storm that collapsed dairy barns, but we created that fund so the state of Minnesota could move money within a matter of days to help folks out. That was brilliant. And that was the legislature in a bipartisan manner did that. I think this situation warrants us looking at it the same way, and that talk is preliminary right now, but it will happen relatively quickly. I feel very positive about this.
Thank you.
The next question comes from the line of Glenn Howard from Star Tribune. Your line is open.
Thank you. To the mental health professionals there, I'm wondering if you're hearing any reports about access issues for children's mental health services, especially crisis services, crisis teams, emergency room visits, psychiatric beds.
This is Sue after Holden. We are hearing that, and there's a recent study showing that ER bed usage for mental health is up. Some children can't actually tolerate telehealth. They really can't sit there in front of a screen, and so they're struggling. We know our day treatment providers are trying to do it in person, which a lot of people don't know, so families should definitely access those services as well. What we're seeing is children who already had a mental illness before the pandemic hit are definitely struggling during this time.
Would anyone else like to add to Glenn's question?
Well, I do have a follow-up. We've heard a lot this week about how COVID infections and exposures are shrinking the available workforce in hospitals, clinics, and long-term care. Are we seeing the same thing with mental health therapists? And
Glenn, this is Julie from Lighthouse. Currently, we have 7 staff that are quarantining, including myself, due to either someone in your family testing positive or having been in close contact. Well, the benefit we have right now is that we've done telehealth. We rushed to get it set up back in March, and so now we have it available to us. The legislature has done a good job of being able to allow us to do much of those services via telehealth, including in some cases day treatment if it's appropriate for the correct age. And so, it's same as distance learning. We're shifting back and forth, but we're doing the best we can. If our staff are quarantined but they're not ill, they can still provide a service. But if they are too ill, again, we have telehealth, so we can sign people up or get people hooked up with services from any of our other providers that are available.
I'll just jump in on that too. This is Jody Nelson from Change Inc. We have not experienced any turnover in our staff, and in fact have about 15 graduate level interns that are coming into the field at this time. So this is a very mission driven group of people, understand ourselves to be essential service providers, and if anything, I think people have felt a sense of resolve.
to, to really help others to get through this hard time.
This is Jody Hartstead. Go ahead.
Oh, go ahead, Commissioner.
I was just going to add too that we've heard stories from providers who are using telehealth now, who are able to actually provide more hours of behavioral health per week than they did before COVID. People who report clients with transportation issues or clients with just issues keeping their appointments. And now with telehealth, some providers are providing more hours of behavioral health now than they were before.
And this is Sue. I was just going to add that unfortunately, many of the mobile mental health crisis teams around the state are not doing in-person visits. They're actually doing them over the phone. And so we're really hoping that when the vaccine comes out, that they'll be viewed as first responders so that we can have them going out to mental health crisis calls.
Okay, thank you all.
Your next question comes from the line of Matt Sapik from Minnesota Public Radio News. Your line is open.
Hi there, Governor. This question is a little bit afield as well of today's topic, but I'm wondering if the restrictions need to be extended and you decide that, when will you make the announcement? How soon will you know? I talked to a lot of people in the restaurant business this week that said that they didn't really have as much time to prepare as they would have liked.
Yeah, and they're right. They don't. And I think when the thing that I keep saying is when you're hearing from businesses that are impacted by this, that is a reality, and it comes into clash sometimes. I think, as we said, the ground shifting so quickly, the move that we made last week, and obviously the 8 days in between that, seeing 50,000 cases come online. I think, as we've said, we did the 4 weeks because what we've learned now is 2 incubation periods, 2 14-day periods lets us kind of see what impact we're making. That lets us start to adjust. I really think you'll start to see, after the first couple of weeks, where we're headed. And I think what's hard is I want to make sure I'm being very clear with folks. This is a map that I hate beyond anything. Just like today with 68 more deaths, I know that will be very close to the same tomorrow. And this is going to burn for a couple of weeks, but at that point in time, we should start to be able to see. But the critique of we're never going to be give them enough time that they need, especially in the restaurant business. I think for your listeners and your readers out there, for everybody, that if you're not running a business, you don't realize they've got perishable food in their freezers. And if they can't sell it all via takeout or whatever, that's a cost that's added on to this already horrific financial cost to them. So we hear that very clearly. We try to give as much lead time. I think it'll be really dictated on what the upper Midwest looks like and what the situation is by that first week in December.
And I have a question too for Jan and maybe Chris, if Chris Erisman is on the call today. I recall early on when testing was very limited, early on in the pandemic last spring, you said many times that the real number of infections was likely a lot higher than what the data had been showing. Now that we're having daily tests numbering in the tens of thousands, are you still concerned that testing is undercounting the number of active cases?
Yeah, this is Jan. We are, and the reason that we are is that the rate of growth in cases is significantly higher than the rate of growth in testing. And we are testing more and more all the time, just phenomenally. 345,000 tests just in the last week. And as the governor said, 50,000 cases. So the other metric that we watch really closely is the test positivity rate. So what percentage of the tests are coming back positive? We're at 15.4% test positivity statewide. And we were at about that same level back in April. But back then we were only testing literally less than 1/10 of what we're testing today. So the fact that we've got the same high test positivity rate at such a higher rate of testing just tells us that there's still more virus out there than we are finding with the testing. So we will continue to urge people to take extreme caution and to seek testing when they have symptoms. and to just act accordingly. With this degree of case growth and this degree of community spread, the odds that in any group you're in, that there might be someone infected without knowing it is unfortunately quite high.
And my last question, I swear, how far off do you think that undercount is, given so many more tests now?
I think early on we had said, could be for every case we know of, there might be 10 more. I haven't actually heard an updated figure from, I think that was sort of a CDC estimate, and our data seemed in line with that. I have not heard an updated estimate, but it's a good question. I'll check and report back.
Okay, thanks so much.
The next question comes from the line of Bill Warner from Minnesota News Network. Your line is open.
Hi, Governor. I'd like to follow up on my colleague's question a bit about the request from the hospitality industry. Two-part question, and you saw their letter, I'm sure, in terms of what they're asking for as far as targeted property tax reductions, sales tax forgiveness, some low-interest loans, emergency grants, that kind of thing. But what, in your mind, would be the highest priority items on that? And also, are there any of those things you can do by executive order? I guess I'm focusing specifically on freezing commercial evictions for hospitality tenants. I know you did that for individuals. Can you do some of these things by executive order if it gets locked up and there's really no real progress in the special session?
Yeah, and thank you, Bill, for that. And I think that whole suite of things that they send to us that I think we need to look at. I'm really focused, I think, of getting cash into their hand and into the short run. I don't have my general counsel here, and I have become very disciplined about not speaking ahead of time on what we can and cannot do. I think this one would be if there was an agreement with the legislature. This may be one where if it works faster to have me do it, they may, but anything that comes with an appropriation, of course, is going to go through the legislature as it rightfully should, and they will be partners in that. I think that this is an area where we have close to unanimity around an idea that this needs to happen. I think this would certainly be better for everything to move through the legislature. And I think talking to these folks to listen to them, when they send me the list of saying these are the things that would help us, I know that's the things that would help them. And I think we need to prioritize it along those lines. The property tax issue gets to be a little more complex around, for them because it's in local jurisdictions, what's happening with those local jurisdictions. I will come back and say, we as Minnesota's elected officials have a responsibility to do what we can. The real ability to make a difference on this lies with the federal government. And I would hope we can get a bipartisan, primal scream to DC to get this done. I as I said, spent countless hours with the senators last night, and they get it. They're doing all they can, and I hope it feels like maybe that'll break. But I won't commit to saying on that one, Bill, what we could. I will do it if asked to do all I can, because again, I hope it's being just everyone out there is hearing this, that we need to do this or our hospitals will be overrun. It doesn't mean that it's not without pain and that there aren't people being hurt really badly in this, and that being the hospitality industry and their workforce, just to be very clear. If they're laying off folks, now those folks are worried. Keep in mind, if Congress does not act, eviction moratoriums, all this extra help, all the things that have been put in place, there is a whole cascading set of things that will happen that will plunge our country economically into a really, really bad place. And so I hope we're able to get that done.
Thanks, Governor.
Again, if you would like to ask a question, press star then the number 1 on your telephone keypad. The last question comes from the line of Tom Hosser from KSTP-TV. Your line is open.
Hello, Governor, and everyone else on the call. Governor, I'm wondering if you have seen the statement from the CEO of Sanford Health in South Dakota, and of course, Sanford has a number of facilities in Minnesota, talking about how he's had COVID, he's recovering from COVID, doesn't think he can spread it anymore, so he sent a memo to all of the employees of Sanford saying he's no longer going to wear a mask because it's nothing but a symbolic gesture and he's not going to participate in that. So a two-part question, your reaction to that, and then maybe Commissioner Malcolm can reiterate, what do we know about whether people can get COVID a second time?
Yeah, thank you, Tom. I did read it. I would like to note that the CEO of Sanford Health is not a medical professional. He is not a physician. I'm certainly glad he recovered from COVID. Jan will back this up. There is not solid data to confirm that you cannot get it again. And my point being of someone whose systems are being strained right now, of someone who's hearing from his clinical staff, I don't understand myself why you wouldn't do it to try and show. Leadership requires modeling behaviors that we want to see. Whether it makes a difference or not is his point being that he sees it as, well, he's wrong about that part of it. So I have to tell you, when I saw it, Tom, I was a bit disappointed, because I think if you don't hear the context of this, you're going to hear, oh, here's a healthcare leader. No, this is a business manager of a system who doesn't have and is not supported by the data around this. Jan, you want to add anything about the ability to have antibody protection and what we know and don't know about that?
I'm afraid it's more what we don't know. It just feels like the longest year of all of our lives, but in virus time, it's pretty short. There just haven't been enough cases yet, enough examples of folks who still have symptoms or reemerging symptoms after an initial infection. It can be hard to pin down whether that is truly a second infection. Some people carry a viral load long after their symptoms have abated, and it's just not even really known yet how much of a viral load is necessary for transmission. So, I'm not trying to evade the question, but there are just so many unknowns that I think that's why nobody's willing to say with any certainty at all how much protection or for how long someone who's been infected can count on. It just seems highly variable and unknown at this point. So sorry, I can't be more optimistic or hopeful on that score. It's one of the things we will learn more about as time goes on, but really a murky picture right now.
And Governor, it's just been called to my attention about 5 minutes ago. Apparently Lifetime Fitness, they sent out a release saying they have filed a request under the Minnesota Government Data Practices Act for all communications between, I believe, your office and the health department and whomever regarding discussions about health clubs, including the data used to make the determination they should close. I know you're just probably hearing this for the first time because it literally came out at 2:38, but again, this gets back to that health club question that came up earlier in the call. They have decided to voluntarily to go along with the shutdown, but it appears they're not going down without a fight.
We will gladly provide all the data they request according to law, both spirit and letter of the law. So whatever's in their data practice request, we will put out in as timely a manner as we can. Once again, I will acknowledge that their frustrations and their desire to do this are not malicious. They are simply looking out for their interest, which they should. I have to make these decisions predicated on public health, the best advice we have, and measure that against the economic side of it. So they can know that we'll provide all of the data they need in as timely a manner as possible.
Now, that was a late breaking question. If you'll indulge me for a moment, Julie, I think you had said something earlier, and I want to make sure I understood you correctly. Did you say even though there's a lot more people under mental health stress, you don't have as many people coming forward actually seeking help? And if I did hear that correctly, do you think that's because they don't want to go have contact with other people, or they're reluctant to take advantage of mental health services? But first things first, did I hear you correctly when you said that earlier?
Our numbers would show that our referrals and our intakes at this time have not increased in a way that would match the level of stress and I think distress that people are experiencing during the pandemic. And so, quite honestly, I would expect that we would be receiving, several more calls every day requesting services. I think for many reasons people don't. I think for our rural area, transportation is an issue. lack of access to technology and internet is an issue. And some people don't want in person, and they also don't want telehealth. It's different for each individual. Some people thrive on telehealth. Some people don't want more screen time. And again, I think there's still stigma around accessing mental health services, unfortunately.
And this is Sue. I would say that one of the reasons that we haven't seen the referrals from children is because they're not in front of the teachers. In Minnesota, teachers are trained to identify the early warning signs of mental illness in children and their students. And so they're used to doing that. It's harder to really see those signs and symptoms through distance learning, which is why we think that families really need to know what those signs and symptoms are and to know that there are, in fact, resources available out there.
Thank you all.
There are no further questions at this time. Presenters, you may continue.
Governor, your final
I'd
thoughts?
just like to, yeah, first of all, thank you to all of our experts on the call. I'm grateful for the work you do, and to your staff to please pass that along. And once again, I'd like to thank our journalists who are on here. I think folks who are out there they're covering this and at the heart of this every day, whether they're stories of people who've recovered from COVID or families that have died, or trying to make sure that the voices of hospitality industry and fitnesses are heard. And it's a critically important thing. And they're also, this is weighing on them and their families. So I would just say, Minnesotans, it's not been an easy week, but it was a necessary week. We can do this. And I think we've laid out where we're at, where we're going. We know we're buckling up for a little bit of a rocky ride coming up here, but we've been asked by providers to give them all the help we can give them. We've have folks here who are there to take your calls if you need a little bit extra, but I think this really does come down to, like so much of it, it's not numbers, it's not data. It's neighborliness, and it's about we're all in this together. So I know it's hard, but I would just ask you, keep yourself and your family safe, keep your neighbors safe, be kind to one another, and let's get through to brighter days. So thank you all, and try and have a good weekend.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.
That was Governor Tim Walz signing off on today's COVID-19 briefing with other state leaders.